Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. When most people think about diabetes, they think about blood sugar, insulin, and what to eat. Shingles usually doesn't even enter the conversation, but maybe it should. There's a surprising connection between diabetes and shingles that many people have never heard about. And once you understand why it exists, you'll also understand why doctors place so much emphasis on prevention, especially after age 50. Today, we're going to explain what shingles actually is, why diabetes increases your risk, what complications you should know about, and one of the most effective ways to protect yourself. Segment 1. The virus that never really leaves. Before we talk about diabetes, let's first understand what shingles actually is. Shingles is caused by the varicella zoster virus, the same virus responsible for chickenpox. After you've had chickenpox, the virus doesn't disappear. Instead, it quietly settles into your nerve tissue, where it can remain inactive for decades without causing any problems. For many people, it never wakes up again. But as we get older, or if our immune system becomes weaker, that dormant virus can reactivate. When it does, it travels along nerve pathways until it reaches the skin, producing the painful blistering rash known as shingles. The rash usually appears on only one side of the body, often wrapping around the chest, back, or waist. But it can also affect the face or even the eyes. The rash itself is only part of the story. Many people describe the pain as burning, stabbing, electric, or intensely sensitive to even the lightest touch. For some, the pain begins several days before the rash ever appears. And for people living with diabetes, shingles is often more than just a painful inconvenience. Segment 2. Why diabetes raises the risk. So why does diabetes make shingles more likely? The answer comes down to your immune system. When blood sugar stays elevated over long periods of time, it can interfere with several parts of your body's immune response. White blood cells don't work as efficiently, inflammation tends to increase, and your body becomes less effective at keeping dormant infections under control. That includes the virus that causes shingles. Researchers have consistently found that people with diabetes develop shingles more often than those without diabetes. Some studies have reported that diabetes increases the risk by as much as 60%, while others have found even higher rates depending on the population being studied. Age adds another layer to the story. After age 50, everyone's immune system gradually becomes less effective. When diabetes and aging occur together, the risk becomes even greater. Segment 3. Why shingles hits harder. For someone without diabetes, shingles can already be miserable. For someone with diabetes, it can become much more complicated. When your body is fighting an infection, it releases stress hormones such as cortisol and adrenaline. Those hormones help your body respond to illness, but they also tend to raise blood sugar. That means shingles can make diabetes significantly harder to manage while you're trying to recover. Researchers have found that some people who previously had good blood sugar control experienced noticeable increases in their A1C after developing shingles. Others found that their glucose remained more difficult to manage for months after the infection had resolved. Shingles can also increase the risk of postherpetic neuralgia, often shortened to PHN. This is persistent nerve pain that continues long after the rash has healed. For some people, it lasts weeks. For others, it can last months or even years. Because diabetes can already affect the nerves, adding another painful nerve condition on top of that can be especially challenging. There's also evidence that the weeks immediately following a shingles infection are associated with a temporary increase in the risk of heart attack and stroke, particularly in older adults and those who already have cardiovascular risk factors, including diabetes. And because diabetes can slow wound healing and reduce the body's ability to fight infection, recovery itself may take longer. So what starts as a viral rash can end up affecting far more than your skin. Stress affects blood sugar, it's a fact. The Digital Tao is a simple 14-day guide to reducing digital stress and finding balance. It's not about deleting apps or quitting social media. It's about using technology more wisely. Each day offers a small, practical shift for less noise and more clarity. If you're feeling burned out by constant connectivity, this book is for you. Use the QR code on screen or the link in the description below. Segment 4. The Diabetes-Shingles Cycle. One of the biggest challenges is that diabetes and shingles can begin feeding into one another. As we mentioned earlier, shingles triggers a stress response in the body, including the release of hormones such as cortisol and adrenaline that can raise blood sugar. But that's where the cycle can become a problem. Higher blood sugar can make it harder for your immune system to control the infection, which puts even more stress on your body. Before long, you can find yourself caught in a cycle that's difficult to break. That's why managing your diabetes becomes even more important during a shingles infection. If you're checking your blood sugar once or twice a day, your healthcare provider may recommend monitoring it more often while you're sick. Some people temporarily need adjustments to their diabetes medications until the infection improves. Don't make those changes on your own, but don't be surprised if your doctor recommends them. It's also important to take care of the basics, even when you don't feel like it. Staying hydrated, eating regular balanced meals, taking your medications as prescribed, and getting enough rest all help your body recover. That isn't always easy when you're dealing with severe pain, but skipping meals or becoming dehydrated can make blood sugar management even more challenging. There's another reason to act quickly if you think you have shingles. Antiviral medications work best when they're started within about 72 hours after the rash appears. Early treatment may shorten the illness, reduce the severity of symptoms, and lower the risk of long-term nerve pain. If you notice a painful rash that looks like shingles, contact your healthcare provider promptly rather than waiting to see if it gets better on its own. Breaking the cycle early by treating the shingles promptly while continuing to manage your diabetes as carefully as possible gives you the best chance of a smoother recovery. Segment 5. Prevention. Fortunately, shingles is one of the few diabetes-related complications that we can often prevent. The CDC and the American Diabetes Association recommend the Shingrix vaccine for adults age 50 and older, including people with diabetes. Unlike older shingles vaccines, Shingrix is not a live vaccine. That makes it appropriate for many people whose immune systems may already be under stress. Clinical studies have shown it to be more than 90% effective at preventing shingles in adults over 50, with strong protection lasting for many years. Researchers are also beginning to uncover another possible benefit. A large study published in 2025 found that people with diabetes who received the shingles vaccine experienced lower rates of major cardiovascular events, including heart attack and stroke, compared with similar patients who were not vaccinated. Although more research is still underway, it's another reminder that preventing one illness can sometimes help reduce the risk of others. Despite these benefits, vaccination rates remain much lower than many experts would like, leaving millions of adults with diabetes vulnerable to a disease that is often preventable. Segment 6. Final thoughts. Shingles isn't just a skin condition. For people living with diabetes, it can mean weeks of severe pain, more difficult blood sugar control, slower recovery, and a greater risk of long-term complications. The good news is that understanding the connection gives you the opportunity to do something about it. If you're 50 or older and living with diabetes, talk with your healthcare provider about whether the shingles vaccine is right for you. It may be one of the simplest steps you can take to protect not only your nerves, but your blood sugar management as well. Now we'd like to hear from you. Have you ever had shingles? Were you aware of the connection between shingles and diabetes? Have you received the shingles vaccine? Share your experience in the comments below. And if you found this video helpful, please send it to someone who may not know about this important connection. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.